Assalamu alaikum, Dr. Rashid Mood here. So in this video, we'll discuss the management of snake bite, how you're going to manage a patient with a snake bite. The management starts at the home or in the fields where the patient has bitten by a snake, and most of the time in pediatric age group, the caretaker are the parents. So parents should know, and it is the responsibility of the media and healthcare department and even the healthcare professionals to educate them that how they are going to give the first aid management at the home or in the field or in on a street and anywhere outside the hospital. So first important thing is that you have to alleviate the anxiety of the patient. Patient are very anxious. Snake bite is a trauma, is a psychological trauma. So you have to counsel them that most of the snakes are non-venomous. About 70% of snakes are non-venomous, and though the venomous snakes even can transfer the poison only in case of about 50% bites. So 50% of snake bites are dry bites where the snake is is not properly transmitting the venom to the affected person. So first thing is that you have to reassure, you have to counsel, you have to alleviate the anxiety of the person who is bitten by snake. Second is that if the facilities are available, like in countries where the you can take a sample from the bite site and you can check for the type of poison, then don't wash the wound. But here in Pakistan, these facilities are really not available, so you can wash it with the water. Third is that you have to immobilize that limb. The affected limb, which can be upper or lower limb, should be immobilized. Patient should not be allowed to move that limb because movement will transfer that venom into the circulation and eventually it will lead to systemic symptoms. So you have to immobilize that limb. For that, you can use some splints and you can wrap it up that limb, but you don't have to wrap it tightly because that is not beneficial, and tourniquet is not beneficial, it is not recommended. Cutting of wound and sucking of wound, it is not recommended. Putting ice on the bitten area is also not recommended. So avoid these type of management or treatment as a part of first aid management, and immediately bring the patient to hospital. So now in hospital setting, how you are going to deal a patient with a snake bite. So important thing again is that you will assess the patient, you will take a history that where this occur, how much time has elapsed, what symptoms have been there, how the patient was managed as a first aid, tourniquet was applied or not, and you can also ask them about the history of any drug allergy and a previous snake bite, a previous use of anti-snake venom and its allergic history. In symptoms specifically, you will ask about the neurological involvement in the form of any double vision or any difficulty in drinking water or speaking difficulty or feeling of decreased power in any part of body, and also breathing difficulty. And also you will check all these during part of your examination. You will also see the local area for the fang marks, local any swelling, edema, bleeding, and in the systemic you will also look for the all the sign of neurological involvement. You will give him a tetanus prophylaxis as per his schedule if patient is not been given and we will consider it as a dirty wound. So according to that, we will give him tetanus prophylaxis. We will give him a gram-positive cover, and if required, the fluids can be given. The test that we will advise is the complete blood count. We will do his PT-ability and his electrolyte and RFTs. Another very important test in these cases is that is called as whole blood clotting time. In this test, it's a simple test. You just take a plain test tube and that should be clean, and take 2 ml of blood from the patient venous sample, and we allow that sample to be to for the period of 20 minutes. If after 20 minutes it is clotted, it means the patient is having normal coagulation, and if it is not clotted even after the period of 20 minutes, then it shows that some vasculotoxic snake has bitten the patient and it has significant poisoning effect on that patient. Now, what is the management of specific management of snake bite? So, specific management of snake bite is that in countries like India, Pakistan, Bangladesh, we have a polyvalent anti-snake venom that is effective for the both Copridae and Viperidae family. In Pakistan, most common are the Viperidae family, the common grades, Russell viper, and India both can be seen. The cobra snake is also seen there. So Viperidae family is basically vasculotoxic. They will have great local effects as well as they can cause the bleeding issues and DIC and renal failure. While the Viperidae family, the cobra, the cobra snake, they are seen as toxic. They causes the respiratory issues and even can lead to the ventilation, need of mechanical ventilation. So the treatment, as I already told, that it is anti-snake venom. It is polyvalent anti-snake venom, and the dose is about 8 to 10 vials. So we take 8 to 10 vials. We dilute it into 1 to 5 or 1 to 10 times dilution. So about 10 ml vial, and we will dilute it in 500 ml normal saline for the kids, and we give it slowly over the period of 1 hour. And the dose is same for the kids as well as the adults. The reason is that the same snake bites the kids as well as the adults, so the dose is same because you have to neutralize the poison that is transmitted to the patient. That is same for both adult and the pediatric age group, so there is no change of dose. Previously, it was recommended that you have to do the sensitivity testing in the form of that you take a 1 ml syringe, that is insulin syringe. You just take 0.1 ml or 10 units of the anti-snake venom and the 0.9 ml of the normal saline, and then you inject it subcutaneously to the patient and observe this for the period of 30 minutes for any local reactions or systemic reaction of anaphylaxis. And that if that are present, then you have to give the anti-snake venom cautiously, but you have to give. But new recommendation as per WHO protocol recommends that you should not go for this sensitive testing, but you should directly inject the anti-snake venom. But at that time you should have the injection steroids, solocortive, antihistamine in the form of Avil, and injection adrenaline, and that in case of anaphylaxis you are prepared and you are watching for that. So precaution while giving anti-snake venom is again this is monitoring. Strict monitoring is very important. That with signs of anaphylaxis or allergic reaction, you have to look for the signs of allergy and anaphylaxis in the form of urticaria, diarrhea, vomiting, breathing difficulty, angioedema. And on the first sign, you have to give them steroid, antihistamine, and injection adrenaline. IM is given. The dose you can read from the book. So now, the in case of neurotoxic venoms, there is role also the role of atropine and neostigmine to reverse the neuromuscular blockage. Atropine and is usually given before the neostigmine. The reason is that atropine will antagonize the side effect of neostigmine in the form of muscarinic effect will be masked, and only we will get the nicotinic effect. The next an important question is that should we repeat the anti-snake venom, and how many times we can repeat? So we can repeat the anti-snake venom. It is not a single dose. You can repeat it if there is no improvement in symptoms or within hours, and you can repeat it again. So it depends upon the condition of the patient and response treatment and the worsening of symptom with time. So it was a brief review of the management of snake bite, and these all things are usually I have taken from the WHO protocol for the management of snake bite. Thank you.